Hi, I am Dr. Vikas Kapur. I head the Department of Minimal Access GI and Bariatric Surgery. So today we are going to talk about hernias. Hernias are broadly divided into two categories. One is internal hernias and one is external hernias. The main focus of our discussion today will stay on the external hernias. So external hernias are mainly of two types. One are called ventral hernias and second is groin hernias. Why do we develop hernias? So hernias are naturally occurring, and hernias can occur even after a surgery. So those are called incisional hernias, and they are categorized in the category of ventral hernias. So hernias normally would happen in people who have a weak musculature. The muscle will give way from one point, and from where the muscle wall will break and we develop a hernia. So what happens is the hole which is created, through that the intestines start popping out. So the main symptom of a hernia would be a swelling, and at times if the hernia gets stuck, then you can have pain which can be very severe and excruciating. So don't wait for the swelling to become painful, because pain is a sign of the hernia getting strangulated. So strangulated hernias, when we repair, we refrain from putting in meshes. So hernia repair is not that good. So it should be hernias should be electively operated. So for groin hernias, we do laparoscopy, and I do the procedure which is called a TEP, that means total extraperitoneal repair. Total extraperitoneal repair means that we do not enter into the abdomen completely, but we stay in the abdominal wall. That means we just open up the abdominal wall, place a mesh in between, and the abdominal wall automatically collapses. So you have to understand it has 3 layers, and we place the mesh between the last layer and the anterior abdominal wall. So how it helps is it decreases the incidence of recurrence. For ventral hernias, we have to place the mesh from inside the abdomen, and there are special meshes which are used for ventral hernias. So the mesh gets fixed very nicely to the abdominal wall, but doesn't cause adhesions between the intestines and the mesh. So there is a layer which gets absorbed after a period of 28 days, so that intestines do not get stuck to the mesh. So the complications do not occur. So these patients really do well. Nowadays we are doing advanced procedures which is called total abdominal wall reconstruction. That is component separation, which we do laparoscopically and place meshes like we do it in total extraperitoneal repair, so that the mesh doesn't come in contact with the intestines. Treatment for hernias nowadays is almost pain-free. Patients are ambulated the same day. They are given a normal diet by evening. So it's a very, very patient-friendly surgery. So one should be afraid of the diseases and not of the hernia repair.